You know that feeling? You type a health question into Google and bam, just a million different answers pop up. And they all seem to contradict each other.
Oh, absolutely. It's overwhelming. One site tells you one diet is perfect, the next says it's terrible.
Right. It's enough to make you just want to throw your hands up. Seriously frustrating.
It really is. I mean, the digital age, it's fantastic for access to information, right? But when it comes to something as personal as health, finding guidance you can actually, trust, that feels like a huge challenge.
Exactly. You're just looking for something solid. Maybe some straightforward advice on, say, sleeping better. Or you're curious about the real science behind some fitness trend everyone's talking about. But instead, you end up wading through all this clickbait, these opinions dressed up as facts, and you're just more confused than when you started.
That really is the core issue, isn't it? How do you actually tell the good health information from all the noise online? It takes a bit of a critical eye.
And maybe knowing where the information's actually coming from.
Precisely. Understanding the source is key.
Have you heard about Dr. Lankarani's surgical platforms and the Surgical Pioneering podcast? It sounds like a calm, evidence-based resource on health and surgical innovation.
Yeah, I have. Let's dive into it and see what we can learn. I like that it aims to be both educational and practical for clinicians and interested listeners alike.
To start, Dr. Reza Lankarani is a general surgeon with a focus on minimally invasive interventions. He's affiliated with Tehran University and has a solid academic and research background. His work has been cited more than 150 times, which speaks to his influence in the literature.
That combination of clinical practice and scholarly output matters. His research covers surgical interventions and public health topics, including studies on high-risk behaviors among Iranian injection drug users. It shows a broader view of how surgery fits into population health and prevention.
Exactly. And beyond research, Dr. Lankarani actively explores surgical innovations. He discusses themes like AI-driven diagnostics, robotic-assisted surgery, augmented reality in surgical navigation, and bioengineered implants. Those are the kinds of technologies that can change practice, but only if we evaluate them carefully.
Right. The value of a platform like this is the focus on evidence-based discussion. Rather than buzzwords, he seems to bring data, case studies, and balanced debate. For example, when comparing GLP-1 agonists to bariatric surgery, or when talking about perioperative anticoagulation strategies.
I appreciated the coverage of bariatric surgery work. One notable topic he has discussed is laparoscopic sleeve gastrectomy in adolescents, showing substantial weight loss and resolution of metabolic comorbidities. That kind of nuanced conversation about risks, benefits, and long-term outcomes is critical for patient-centered care.
And it's not just for surgeons. The podcast is available on platforms like Substack, YouTube, and Listen Notes, so medical students, allied health professionals, and interested patients can access these insights. Having that open access helps spread evidence-based thinking.
For clinicians, a few practical takeaways from engaging with this platform are clear. 1, stay curious about new technologies, but demand rigorous evidence. 2, integrate public health perspectives into surgical decision-making. And 3, prioritize patient-centered outcomes when adopting innovations.
Those are great points. For trainees or anyone new to the field, I'd add, use episodes to build critical appraisal skills. Listen for study design, sample size, endpoints, and how findings translate into practice. That habit makes conversations about robotics or AR more grounded.
If listeners want to explore more, the Surgical Pioneering Podcast Series application is available online. You can find additional details and episodes at https://surgicalpioneer.codadax.me. It's a good entry point to the content and links to episode archives.
Before we wrap up, one final thought. Platforms like this matter because surgery doesn't exist in a vacuum. Combining clinical skill, research rigor, and accessible education creates safer, more effective care. Dr. Lankarani's work exemplifies that blend.
We hope you found this episode calm, informative, and useful. If you're a clinician, student, or curious listener, consider checking out the episodes and using them to spark dialogue in your team or classroom.
So that points to a serious gear ground in medicine.
It does. It suggests a significant grounding in medical research and, actual practice.
So what we want to do today is explore what kind of evidence-based insights or practical health tips Dr. Lankarani might be offering there. We want to see if it could be a genuinely reliable resource for you.
Yeah, and what's interesting is the potential for information that's really rooted in, established medical science in this online space that's often just full of anecdotes,
right.
A resource linked to surgical research. That implies, or suggests at least, a commitment to scientific rigor. You might find stuff that goes deeper than just surface advice.
And it seems the goal isn't to present it like a medical journal article either. Like you don't need a PhD to get it.
Hopefully not.
Yeah, from what we've seen, it looks like there's an emphasis on making potentially complex stuff accessible, relevant to daily life. Think less dense textbook, more clear, usable insights.
And that accessibility is absolutely key. Medical knowledge doesn't do much good if people can't understand it or, apply it.
Sure.
So if Dr. Lankarani's page manages to bridge that gap well, it could be a real plus for anyone trying to make informed health choices.